What happens when your heart skips a beat? Have you ever felt that sudden, unexpected thump in your chest? Before we continue, don't forget to like and subscribe for more. It feels like your heart stopped for a second, then hit harder than normal. That sensation can be frightening. But what's actually happening inside your body? Let's step into the anatomy lab and break it down. Your heart is not just a muscle. It's an electrical machine. Inside the upper right chamber, the right atrium, lives a tiny cluster of specialized cells called the sinoatrial node, or SA node. This is your natural pacemaker. It generates electrical impulses automatically, about 60 to 100 times per minute. Each impulse spreads across the atria, telling them to contract. Then the signal moves to the ventricles, causing them to pump blood to your lungs and the rest of your body. This coordinated electrical pattern creates your steady heartbeat. Lub-dub, lub-dub, lub-dub. But sometimes, an extra electrical signal fires earlier than it should. This is called a premature contraction. It can start in the atria, known as a premature atrial contraction, or in the ventricles, called a premature ventricular contraction. Because this beat happens too early, the heart chambers haven't completely filled with blood yet, so the contraction feels weak. Then comes a tiny pause. During that pause, the heart fills with more blood than usual. When the next normal beat occurs, it pushes out a larger volume of blood. That stronger contraction is the thump you feel. So your heart didn't actually skip a beat. It fired early, then corrected itself. Now let's talk about why this happens. Premature beats are often triggered by stimulants like caffeine, emotional stress, anxiety, dehydration, lack of sleep, or hormonal shifts. These factors increase adrenaline levels in your bloodstream. Adrenaline makes your heart's electrical system more excitable. Think of it like static interference in an electrical circuit. Most of the time, occasional premature beats are harmless, especially in healthy individuals. In fact, many people experience them without ever noticing. However, if skipped beats become frequent, persistent, or are accompanied by symptoms like chest pain, dizziness, or fainting, medical evaluation is important. Your heart beats about 100,000 times every single day, and it does this without rest. A brief, irregular beat is often just a momentary electrical misfire, not a sign of failure. Understanding your heart removes fear, and when you understand your body, you gain control over your health. This is the Anatomy Lab, and your body is more intelligent than you think. Tell me in the comments about what you learned. Thanks for watching.